In the 1950s, one of the most common operations that was performed was emergency operation for bleeding peptic ulcers. When I was a surgery resident in the 70s and 80s, we thought that the new antacid medicines were wonderful because they pretty much help control that acute bleeding episode. And nowadays, bleeding peptic ulcer is extremely rare. Reflux actually was very rare and essentially didn't occur until after World War II. But dietary changes, a lower fiber diet, probably is related to the tremendous increase in hiatal hernia disease and reflux, which it causes. Physicians have basically been focused on the stomach contents treating GERD or reflux and not the mechanical causes of it. But basically the valve got ignored through the 70s, 80s, 90s, and even until after the turn of the century. Now, the first drugs that came out were Pepcid and Zantac, and they're called histamine 2 antagonists, and they were effective. And then the so-called proton pump inhibitors, the Prilosec, Nexium, Dexilant, Prevacid, Protonics came out, and these were amazing as far as slowing down acid production. We didn't understand how that was going to have side effects, though, when they first came out in the 80s. What we now know that's been documented, there are 3 warning labels on all proton pump inhibitors, and none of them are approved for long-term use. There is an article showing a significant increase in Alzheimer's, significant increase in stroke, significant increase in heart attacks. It's obvious that if you take these pills, you really need a diagnosis for sure. And even the American Gastroenterology Association says that 40% of people on these pills have no business being on them. We feel strongly that you should have strategies to try to get you off of the proton pump inhibitors to at least the Zantac Pepcid drugs, which are safer. And then if you can get with GERD-friendly lifestyle and diet, maybe some weight loss, you can get down to just taking occasional Tums or Maalox Mylanta, then you're going to be tremendously healthier with much less problems than if you continue taking a drug that's not approved for long-term use and has significant baggage.